this time I'm pleased to recognize the gentleman from New York, Mr. Reid, co-author of the bill. 3 minutes, please.
The gentleman from New York is recognized for 3 minutes.
Thank you, Mr. Speaker. And first, I'd like to thank my colleagues, Mr. Engel, and the members of the Energy and Commerce Committee for your leadership on this bill, as well as, in particular, my colleague, Mr. Carter, for helping push this bill through, and Dr. Burgess for his assistance in leading the floor debate. Mr. Speaker, I rise in strong support of the bill before us, because, as we all know, when loved ones become deathly ill, we are often left feeling helpless, wanting to step in and somehow ease the burden, but not sure how. When my own mother became sick, there was nothing I wouldn't do, Mr. Speaker, to cure her. But the woman who taught me how to live taught me how to die. She taught me that what was truly mattered to her in those times at the end of her life was the comfort of her home, the comfort of her family, and that quality time to be spent with her loved ones and her friends. Surrounded by a wonderful team of family, friends, but in particular, hospice care providers, we watched as her wishes were met. Physicians, nurses, social workers, and aides made sure her symptoms were managed and that she was physically comfortable. But just as important, if not more so, were the hospice volunteers who stepped in to give Mom companionship, normalcy at the end of her illness, and a much-needed break by the loved ones that were caring for her, such as myself and my brothers and sisters. The experience changed my perspective on death and dying. Even now, I am enormously thankful for the hospice staff and volunteers who stepped in to give my mom and countless others in the community and folks across the country quality of life when their days and her days were limited. We must ensure that there is a properly trained workforce to care for those closest to us as they increase in age and become chronically and terminally ill. Estimates show that there will be no more than 1% growth in the palliative care and hospice physician workforce in the next 20 years, while the number of people eligible for palliative care will increase by over 20%, Mr. Speaker. Without a boost for palliative care education and training, there will only be one palliative physician for every 26,000 seriously ill patients by 2030. This bill promotes a strong American workforce when it comes to our palliative and hospice volunteers and caregivers, and advances training for those healthcare providers providing those services amongst us. I thank my colleagues and urge all my colleagues to support this legislation and vote yes this evening. Thank you, and I yield back.